hope many people can join today. It's going to be an interesting topic. So today, I want to start off by saying that would you rather prevent cancer and heart disease or get the best treatment? The answer is obviously you want to prevent it, because no matter how good the treatment for cancer is, the outcome usually is not satisfactory. And for heart disease, we have fantastic treatments, but the problem really is that it's unpredictable as to the extent of the damage from a heart attack. So you're really you're leaving it to chance. So today the concept has to be, is prevention better than treatment? And the answer is yes. But what are the concepts of preventing? How can you predict? How can you prevent? And this is not theoretical anymore. This is very much the forefront of the 21st century medicine right now, because you incorporate biological ages, you incorporate things like how you can slow down the aging process, and when you can reverse aging, you can be sure you can reverse disease as well. So that's kind of where we're at. We'll just wait for a few people to join, because today the main thing is to see if we can do a lot of questions and answers, either related to heart disease, cancer, and what's coming up to be very, very common is things like fatty liver disease, dementia, and they're all part of it's the same spectrum. So you may imagine that, somebody with diabetes has no risk for dementia. That's not true. You may imagine that the risk factors for heart disease are independent of risk for a factor for cancer. That's not true, because there are some key signals that are common to all of these things. That inflammation is probably the best known and well documented in being the prerequisite to heart attacks, dementia, insulin resistance, and obviously diabetes, arthritis, wear and tear, in other words, aging, right? So as far as I express in my presentations, I tell you that aging can be measured with the epigenetic clock. That is far superior than the telomere length. And so aging is a risk factor for disease. So my question again was, would you rather have the best cancer treatment, or would you, I think there's some Spanish questions coming along right now, or would you rather have the best treatment? Look, the good news is that as a doctor, an MD, and I am an MD, that I can treat the diseases either conventional route and in employing more natural therapies, even during a crisis. The main thing is to be able to predict some of these things, and you can predict them either with genetics. Some of those genetics might be MTHFR. What that means that your ability to methylate is compromised, so those people get more cancer and more heart disease, particularly if you're homozygous. That means you got the gene from your mom and your dad. And then if you have things like inability to produce glutathione or utilize glutathione peroxidase, then your drain, the drain that gets rid of the junk. So you could have a sink full of junk, but you have a big drain, you're probably not going to get anything clogged up. But you have a sink and you have a small drain, that's your liver, that's your glutathione, that's your ability to detoxify. So really the equation is all about, what are the mechanisms in your body to regenerate itself, to repair itself, to eliminate things. And that's the kind of conversation that's been missing, because for the majority of the situation, when it comes to blood pressure or diabetes or heart disease, the conventional thought is to wait for the disease, wait for the diagnosis, and then begin the treatment. That is the false narrative that has to be changed. It's not wrong. It's what we learned 30, 40, 50 years ago. It's no good doing the same thing and expecting better results. You have to understand that that model was for 30 years ago. I've been a physician for almost 30 years, and I can tell you that that model was there probably before that. So why did the doctors speak out against Fauci? He got caught violating and lying to Congress. I'm not sure about that. If you can be specific about vaccinations, then we can talk about that. But really, let's focus on, do you want to prevent disease or do you want to treat it? You obviously want the good doctors to be able to treat it, but you want even better doctors who can prevent it. That's actually a Chinese proverb, by the way. And so the conventional thought process is you have to have a diagnosis before you give the treatment. And most of those treatments are based on prescription medication, which merely controls the disease, does not actually get rid of the disease. Because if you don't understand what causes the disease, how can you possibly cure it? The causes are generally inflammation, oxidation, toxicity, and they actually have a lot of overlap. And the biggest overlap is this: if you have cardiovascular risk factors, then you are likely to have neurological risk factors, not just for stroke. So in other words, you're only as old as your blood vessels. So therefore, if your blood vessels are getting advanced in age, your brain is going to get advanced in age, like dementia. But and so that's a big deal. That's a big deal. And what's common to heart disease? Inflammation is the biggest risk factor for heart disease. Therefore, inflammation is the biggest risk factor for cognitive decline. Then you may say, well, what's that got to do with cancer? Well, let me reverse it and give you a different way to look at it. The first way to look at it is, what's the number one killer? Heart disease. What's the number two killer? Cancer. So heart disease trumps cancer. There must be something common about the core things that lead to heart disease that must have some similarities with cancer. That's true. It's called inflammation, oxidation, toxicity, insulin resistance. Now, that is not the end all or be all, but those things actually damages the body's ability to check DNA damage. We call those checkpoint inhibitors. So almost every case of cancer, there is loss of this checkpoint system. And the gene for that is called the p53 gene. Everybody with cancer loses the p53 gene's ability to check DNA damage, because when you have the p53 gene, like I have and hopefully you have, and if you're young enough you have it, is to check for damage to DNA, and once it checks for that, eliminates it. If you cannot check for it and eliminate it, then you will build up increasing numbers of damaged DNA. That's a prerequisite to cancer. So the things that can help you with heart disease can actually help you prevent cancer. How? Exercise is good for you. Why? Because exercise can also reactivate the p53 gene, because exercise activates heat shock protein. So the mechanism is heat shock protein. Exercise is good for your heart. It's good for your brain. It's good for cancer. Now, we didn't know all these things 5 or 10 years ago. All those new knowledges are coming together, and now the pieces of the puzzle are coming together. So no longer do you have to believe the doctor who says that today is just for high blood pressure, tomorrow we'll talk about diabetes, and the next time we'll talk about heart disease, and cancer is totally different, and no, you cannot do anything other than block hormones. That is nonsensical. That's called two-dimensional medicine. It worked for a while. It's showing its limitations right now, and we have to break that. So in summary, so far what I've said is that, would you rather prevent a disease or would you rather treat it? Hopefully you have the answer to that. The next one is that most doctors have to wait for the diagnosis before they treat, and that usually results in using prescription medication. And the third point I was saying is that there's a lot of overlap of all these different conditions. So if we can address them, not only can we better treat people, we can actually prevent them. So the number one way to prevent disease is to slow down the aging process. Because the biological aging, it's not about your chronological age, it's about your biological age. So you could be 50 years old, but your biological age could be 60 or 65. Then I would say you need vaccinations. You need to get the shingles vaccine. You need to think like you are an older person. Conversely, I have patients who are 80 years old, but their biological age might be like a 60-year-old. And so this is the key. The World Health Organization have deemed aging as a risk factor for disease. So diabetes is age-related disease. I think we may have a question on BRCA gene there. If you already know you carry the BRCA gene and have breast cancer, is there anything you can do? Yeah, listen, so BRCA gene, so let me just give you a little background. A lot of people believe if you have diabetes, you have heart disease, you have cancer, then you must have a gene for it. Majority of the people do not actually have a specific gene for those things as of now. We may change that. What they do have is defects in the methylation system. Now, to go to BRCA gene, it is very, very specific for breast cancer and somewhat specific for ovarian and uterine cancer, frankly. Ovarian for sure. The problem there is that it is very specific and a high risk for those cancers, but in fact, very few people carry that gene, thank God, because if you carried that gene, you'd have to take some dramatic action. Now, the question really was, if that individual has the BRCA1, BRCA2 gene, then we need to engage all of our different defense mechanisms to mitigate the risk, right? You can't change your gene, but you can alter the epigenetic expression. So for example, I have the genetics for blood pressure. I have the genetics for diabetes. I have the genetics for heart attack. I have the genetics for a stroke. Not only have do I know that because from my parents' side of things, but I actually have measured those genes. So my job is to look at that DNA, look at the different loci, different locations in that DNA, and see if the genetics for inflammation is turned on, I got to turn it off. If the genetics for obesity is on, I got to turn it off. And so I can go down the different parts of my epigenetic expression, and when the things are bad, turn them off. The good genes you activate. Some of those are not measurable by me per se, but we do know that sirtuins are longevity genes. You can activate them with exercise. You can activate it with fasting. You make sure you sleep properly. You take resveratrol or things like antioxidants. Then you can actually do that. So just so that people who are new to this and have not met me, I'm an MD that practices real medicine and looks at all the other therapeutic interventions as well as knowledge to be able to give better results for my patients. So we try to use alternative therapies, complementary therapies, holistic therapies. It doesn't really matter what you call it. The aim is to be able to identify the risk factors for disease and to be able to prevent it. Should you have the disease, to control it and then to reverse it. And so for myself, and being a regular doctor, follow the standard of care. And then I go above and beyond. So I myself, the things that I preach to you, I am practicing those things. The diet, the exercise, the supplementation. For those who don't understand supplementation, they say you don't need it, you pee it out. You know, if you listen to any of my conversations or my videos, you would see the evidence behind what I'm saying, right? And then same with the IV vitamins. They say, well, if you're getting it in your diet, how do you need IV? It's because I'm using it in a therapeutic manner and my results speak for themselves. And the ultimate must be my ability to be able to carry down on myself. And what is that ability? I have a biological age that's 10 years younger than my real age. I have a calcium score in my heart that is 0. I have loci on my DNA that is for diabetes. It's turned off. So this is evidence-based medicine. I will soon be able to identify oxidation at the mitochondrial level, and I have strategies. I will demonstrate those strategies by repeating the labs and showing that I have the ability to get rid of mitochondrial damage or oxidation. I easily can lower inflammation. That inflammation, whether it's generalized inflammation or you have inflammation as part of a rheumatological problem. Again, Diane is joining. Thank you. Quite interesting, Doctor, about breast cancer was a young age. My breast cancer was at a young age. Okay, you know, we will talk a little bit more about cancer if people want, but, you know, keep the questions coming in. There's another question here, Dr. Habib. We'll follow his talk and open Q&A. Okay, got it. Okay, right. Okay, excellent. Okay. I mean, look, cancer came up, so let's talk about cancer. So again, the principle is this. Every cell has to divide. And when it divides, number one, your telomere gets a little shorter. The job of that telomere is to make sure that that new cell, the duplication, replication, whatever you want to say, is perfect. And it uses the telomere to do that. So as you get older and the more and more cells divide, your telomere gets shorter. But as the telomere gets shorter, its ability to help you duplicate or replicate the cells, is a more specific terminology, it becomes less effective. So more and more DNA that is not quite perfect are lying around. And so there is a point, a critical point, where your telomere is no longer able to replicate perfectly, and the buildup of damaged DNA accumulates. That increases the risk factor of cancer. And we have more evidence of what happens. We not only lose the telomere gets shorter, but we know that as you get older, your growth hormone goes down, your nitric oxide level goes down, your inflammation markers go up. So these are all part and parcel of the picture. There is no one parameter to say you will get cancer. Like the person that asked about BRCA gene. Luckily, very few people have BRCA genes. I only know a handful of cases. And those are not even personal. Those are things you hear about. And so the critical part is that all those factors ultimately lead to the damage to your checkpoint system. That checkpoint that would ordinarily eliminate those damaged DNA. So it's not just one thing, it's multiple factors. And as I said, if you know how to re-engage your body, reactivate your body, activate the longevity genes, not only can you live longer, you can stay biologically young, you can prevent disease. This is not theoretical. This is in clinical practice, practices like myself. Okay, what can I do to support liver detox? I already I take glutathione daily. Great, excellent. So let's talk about the liver. The liver has multiple benefits. It is your number one organ for not only detoxification, but your immune support. Because the best way to support your immune system is to get rid of toxins. So everything you eat has to be processed and filtered through the liver. And therefore, it is one of your master, that's like a checkpoint, right? It's checking what's coming in, absorbing what it needs to, processing what it needs to, and then eliminating it through your gallbladder into the feces and so forth. Or conjugating it, making it water soluble, so once it goes through the bloodstream and around the kidney, then the kidneys can pee it out. So that's where the liver is really part of it. It's at the key to anything and everything that enters your body, because after you've eaten, it goes through the gastrointestinal system. From the gastrointestinal system, it's going to go get absorbed into the bloodstream. We call that enterohepatic system. From there, the liver will filter it out, and the conjugated, that means to make it water soluble, so the kidneys can pee it out, or to make things, absorb things. Your liver is the master organ in regulating carbohydrate metabolism, protein synthesis, fat metabolism, and the list goes on. It's where your immune cells are produced as well. So it's really important not to wait until you have fatty liver. It's really important not to wait until you have liver failure. And we have evidence to say that glutathione is the thing that can not only regenerate the liver, but actually support the liver in its mission for immune function as well as detoxification. So how do we know that? Let me give you an example. So when we go to the emergency room for people that have Tylenol overdose, what's the problem? The problem is that you deplete your glutathione level. So we take something called N-acetylcysteine in the form of mucomist. And by taking large amounts of N-acetylcysteine, your body can produce glutathione. And from that, you can actually reverse liver failure from Tylenol overdose. So now we have to extrapolate to some degree. If it can reverse liver failure, then why can we not use it? So I do. When I use large amounts of glutathione as therapeutic, and I'll measure these levels too, not only can I bring down toxicity numbers. So for doctors who understand what gamma GT is, one of the markers for liver toxicity is gamma GT. It goes up when you drink excessive alcohol, because alcohol is a toxin. So when I use glutathione, I can actually see the gamma GT coming down. That's evidence to say that the glutathione is detoxifying. And we know that glutathione regenerates the liver, because I just told you, we have liver failure from Tylenol overdose. It's reversed with glutathione. But we use N-acetylcysteine so the liver can produce its own glutathione. So that's very, very important. And that, the glutathione is a very, very important thing to talk about, because, measuring it is important. When you have low levels of glutathione, you have more heart disease, more cancer, more toxicity, just more diseases. When you have short telomeres, you have shorter lifespan, more diseases. So these are not by themselves end all or be all by having one metric. It's the accumulation of all of these metrics that together result in what we call biological aging. And that is the ultimate. If you can slow that down, reverse that, then you're going way ahead. So the question is a good continuation. The question is about non-alcoholic fatty liver disease. So can you reverse that? First, let's talk about what it is. Non-alcoholic fatty liver disease is probably going to be, if not already, it is actually already the third most common disease. The most common disease is heart disease. And the most common reason to die is heart attacks. The next most common disease is cancer. The third most common disease is non-alcoholic fatty liver disease, which can then go on to what we call NASH, non-alcoholic steatohepatitis. That's inflammation in the liver, one step worse. So what is fatty liver disease? It's the accumulation of fat. The number one way to accumulate fat in your liver by eating too many carbs. That's why people that talk about keto, they're kind of almost right. Almost right. Because what happens that for a select group of people, which may be more than you realize, if they already have a buildup of fat in their body, we call that ectopic fat, they already have insulin resistance. So when you then have a keto diet that's high in fat, then you can make the insulin resistance worse. And insulin resistance and inflammation go hand in hand. A little complicated, but I just wanted you to understand that not everything that sounds good is always good. And that's why this is a good opportunity for me to say that, what I'm telling you is about for education purposes, is for information, so you can become better consumers. You can ask your doctor better questions. You can go and learn about these things. And Amy, these are fantastic questions. So slow it down, because each one I want to be able to give you a little bit more of a thorough answer. But great questions, Amy. And um, so listen, non-alcoholic fatty liver disease is very important because what are we saying? If you have fatty infiltration in your liver, number one, you'll have insulin resistance, which is bad if you're going to be diabetic. And not everybody who has insulin resistance will become diabetic. Not everybody with fatty liver actually has insulin resistance. There's a lot of medicine is never black and white. But as a general rule, if you have fatty liver disease, you're going to have more likely to have insulin resistance. If you have insulin resistance, you're more likely to have diabetes. And worse still, insulin resistance can increase the risk of cardiac disease as well as dementia. So fatty liver is a real problem. And it can drive all the other things that come beforehand. As I said, heart disease and even cancer. We just can't tell you that it's a direct link. We don't have to give you a direct link. There are very few things in medicine that's a direct link. In other words, cause. So there is no doctor that's going to tell you hypertension is the cause of heart attack. It's not a direct link. It's an association. Obesity does not cause cancer or heart disease. It's an association. It's a link. There's very few things in medicine that's a direct cause because it's very difficult to figure out the exact point of getting the heart attack, the exact reason for the cancer coming. But there are many, many factors that are associated with it. And cumulatively, if you're smart, you take it seriously. Do not wait for your perfect test, wait for your perfect answer, the perfect vitamin. You have to engage your diet. You have to engage your lifestyle activity. You have to sleep right. You have to take your vitamins because most people are low. You then have to boost your system, particularly when your drain is weak. You have the genetics for weak detoxification. You have the weak genetics for methylation. So I'm speaking fast. Sorry about that. Let me slow it down. So, that's a lead to saying if you want to know about methylation, it's a big deal. But so the next question here is, is it better to take N-acetylcysteine or just glutathione? Very, very good question. N-acetylcysteine is a precursor to glutathione. Some people can convert it just fine. But as you know, there are a lot of SNPs. That's certain mutations that don't allow those pathways. Those SNPs are in the enzymes. So enzymes is very difficult for you to create. You can't create it. It's already there. Preserve it. The enzyme for longevity, preserve it. The enzyme for nitric oxide, preserve it. The enzymes for making glutathione, preserve it. Because everybody's looking for the best and greatest next thing. No such thing. What you want to do is preserve what you were gifted with. And you preserve it by don't overeating. You preserve it by avoiding refined food, refined carbohydrates. You want to preserve it. You want to preserve it. I can't say that enough. You preserve it by not overeating. You preserve it by stressing your body. You can stress your body with exercise. You can stress your body with fasting. You can stress your body with heat, sauna. Yesterday I went to the gym and I went swimming and I finished off with the sauna. I felt like the sauna would bring out the chloride from the sweat glands, and then the sauna would create the heat, which actually activates heat shock proteins. Exercise activates heat shock proteins. Fasting activates heat shock proteins. Heat activates heat shock proteins. Heat shock proteins activate your checkpoint inhibition, your p53 gene. You can try to activate yourself. And when you have the disease, particularly in later stages like 3 and 4, your diet won't be enough. Your vitamins won't be enough. Even IV vitamins won't be enough. You need to really, really understand how to reactivate your enzymes and those longevity genes. Hopefully that was a very good question from Agor. Really good question. All right. Let's see if I missed some questions back here. Yep. So other things to support liver detoxification. I have very healthy gut. A healthy gut is the key to not overburdening your liver. So when you overeat, when you have too many refined foods, when you put the wrong food, the processed fats, you are not only making the gut microflora really, really stressed out, which then sends signals to the liver as well as the adiposity, which then releases inflammation. So when you're talking about rheumatoid arthritis and you talk about inflammation, you have to ask the question, where does this inflammation come from? The inflammation marker may come from the liver, but don't blame the liver. The liver is only responding to something. And what that something is what's going on in your gut. It's called the gut microbiome. The gut microbiome can control the genetic expression. So when we eat the right foods, we can activate the right genetic expression. So when we have bad fats, we are actually altering the genetic expression within our mitochondria. That's why we feel sluggish and tired. It's not just, I ate and my sugar was high and I felt really tired. That would be nice, but that's for a small group of people that may have spikes in blood sugar. Most people don't have spikes in blood sugar in the way that we just, they assume. It's actually much more complicated than that. But that's why having a healthy gut gives the liver the kind of break it needs, and so the liver can flourish. Eating the right foods is really not food for you, it's nourishment for the microbes. Nourishing the microbes is the number one way to have not only better gut function, better gut integrity, as well as a better immune system, because next to the 26 feet of gut is your lymphatic system. We call them pious patches. These are kind of lymph node fortresses that hold on to all those immune cells. And so what is this thing about, diet is not the cause of cancer? What is it that diet is not the solution to heart disease? Dean Ornish, who's a cardiologist back in the 1990s, I mean, we're in the 21st century. 1990s is like prehistoric. I'm from the 1990s, by the way, but I'm not prehistoric because my biological age is very young. And my brain age is even better. By the way, I measure my brain age too. So listen, so food is the way to reverse heart disease. Dean Ornish showed that the vegetarian, he doesn't always have to be vegetarian, but he showed his way, which is that vegetarian or plant-based diet is the way to go, to reverse heart disease, not even prevent, reverse heart disease. It's so much harder to reverse disease than it is to prevent. For people who are joining in, preventing disease is easy when all the things are working. Once you have the disease, you've already damaged many, many factors. You can reverse it. It's actually harder. If you don't hear my urgency in what I'm saying, you need to get a pulse. It's a joke. That gives me time to just calm down, take a deep breath, take some more questions. So Iris gave me some really good questions. I think I saw your comments on Instagram. So let's see. Should heart palpitations be a concern? Not necessarily. As a medical doctor, I'm obliged to kind of give you my medical spiel. So if you're, this is the rule of thumb, and this is what your doctor is, the algorithm that your doctor is going to be thinking about, because I'm a doctor, I have an algorithm. If you're over 50, take things more seriously. If I'm exercising, I've got palpitations, well, that's because I'm exercising, right? Palpitations is just a description to say that you can feel your heart beating. If I'm anxious, I'm going to get palpitations. So it depends on the environment. So if I'm exercising, it's maybe not abnormal. If I'm stressed out, maybe it's not abnormal. I think the next rule of thumb is if something is persistent and causing you symptoms like shortness of breath, then you take it more seriously. You're on medication. You're diabetic. You take it more seriously. There are some young people that have just what we call sinus tachycardia. There's nothing abnormal about them. They just have a heart rate that's over 100, which is not ideal. But it's not going to be life-threatening for a young person. But it's good to look at the rhythm problems. There are some electrical rhythm problems, which is, again, very rare. It's not common. And those give you a fast heart rate, which can also give you palpitations. Those rhythm problems are like WPW. It's increasingly larger number of people are getting atrial fibrillation. But because atrial fibrillation is quite common, let's talk about that. Atrial fibrillation is the upper part of the heart chamber called the atrium. And from the atrium, blood flows to the ventricle. And from the ventricle, the blood is released around the body, starting with the brain and down the arms and the abdomen to the legs and so forth. So in atrial fibrillation, what happens is that the rhythm of the atrium is quivering. It's got its own rate, and it's not matching the rate of the ventricle. And in some people, that rate can be so fast, we call it atrial fibrillation with a rapid ventricular rate. That's a very medical terminology, just for the medical people out there who might doubt that I know my medicine. So I use my terminology very, very precisely, very precisely. When I'm using holistic terminology, I explain what's holistic. And when I use medical terminology, I use very specific terminology. Anyway, that's just, so let me continue. Atrial fibrillation by itself is okay. We don't even take it seriously unless you're over 50. When I say we, I take everything seriously. But a cardiologist won't take it seriously until you're over 50 because we know there's no bad outcome. Why is that? Because below 50, you're biologically young enough that there's no bad outcome. But if you're 50 or say 49, but your biological age is 59, you might rethink that. Why? Because as you get older, that atrial fibrillation may be part of heart disease, stiffened heart vessels, other risk factors for heart disease like blood pressure, cholesterol, diabetes, inflammation. And so, atrial fibrillation is becoming more and more common. Why? Because, people are diagnosing it because of something called Apple. They have the Apple Watch, right? Or they have that probe, the EKG. So that's all good. It just freaks people out because now, oh my God, I got atrial fibrillation. Don't panic. As I said, if you're less than 50, you're going to be fine, as based on what the cardiologists say. But my opinion is, why do you have it? How old are you biologically? How old is your heart? Is there something that's making your heart overstimulated? Hypothyroidism is a medical condition, but stressed out, adrenergic drive, overstimulation of the sympathetic pathway, not being able to relax like me. But I know how to understand my parasympathetic. I take deep breathing techniques to slow down my heart rate. It's called parasympathetic. You can activate your parasympathetic, which is actually good for the immune system as well, by gargling. Gargling stimulates the vagus nerve. Carotid massage can lower the heart rate, stimulate the vagus, and stimulate the parasympathetic, which is good for the immune system. They actually have electrical devices that you can put on the vagus nerve because they know that it can prevent migraines. It can also treat anxiety and depression. There's so much overlap. But why is it that FDA approves it for one thing and not another? Why is it that one specialty uses it, but the other one doesn't? The good news as a primary care doctor, I can use anything, anytime, any place, anywhere. That's my motto. It doesn't matter what the problem is. I can answer any problem you have, majority at least. So anyway, the AFib was a good conversation piece in my mind, at least. No meat, no dairy. Well, we can talk about that. I personally don't like dairy, but you can get non-cow dairy. That's okay. And cows are fine. I have nothing personally against cows, but cows have been bred and they've been fed and they've been treated so badly. Have you heard that phrase? You've been treated so badly, Donald Trump. You've been treated so badly. Your cows have been treated so badly, being fed junk, corn instead of grass, no exercise, stressed out. How do you expect the cow's products to be healthy? You treat the cow badly, you feed them badly, they're going to give you bad product. It's like yourself. Eat junk, don't exercise. Now you're healthy. If somebody from outer space ate you, are they going to be toxic? Probably. It's kind of a joke, but it's a serious joke. Everything I just said was factual, by the way. So dairy is not a problem. It's how you treat the cows. If the cow is grass-fed, like in Ireland or Australia, you'll be fine, probably. But the protein from dairy, cow milk, is very hard for the human to digest. And at the very least, it creates more secretions, which is not desirable in this day and age. So I would try to find alternatives. So I do coconut milk. Almond milk is not rich enough for me. Coconut is good source of fat. And the more good fats I have, like from organic eggs, which I do in moderation, from avocados and walnuts and nuts and seeds and salmon, the more good fats I have, I squeeze down the bad fats. Just taking the good fats brings down the bad fats. We don't have to block it with a statin. It's like, eat whatever you want and I'll give you a drug. Does that make any sense? It's as bad as waiting for a diagnosis. I know it sounds bad because it is bad. And if the doctor doesn't feel bad, he needs to look in the mirror and reassess. And I'm just saying reassess with all due respect. What I think he should really do is learn to improve his tools. When we come out of medical school, we're not the final product. We're a work in progress. We're supposed to improve. If your doctor is practicing the same way, with the same medicine and the same mindset for the last 10 years, or God forbid, 20 years, he's obsolete. Go find a new doctor. It's kind of semi-joke. But don't worry, there'll be plenty of job for those doctors because there's plenty of sick people and there's plenty of people lining up with misinformation that's been perpetuated by media. And so every other TV ad is about a drug. Why would you need to change your diet? Why would you need to exercise? It's just too much pain. And just take a drug. Well, because the temporary stress activates the longevity gene. The temporary stress is like fasting, activates longevity gene. The temporary stress of exercise, particularly high intensity interval training, and we can talk about that, activates longevity genes. So, there is no shortcuts. We can trick the body, biohack, but no intelligent human being thinks that he's going to be smarter than the body the person that, or the entity that created the body with all the amazing, we're just discovering how to play with it. We just discovered how to utilize it. We didn't make it. Doctors don't make things. We repair things. We try to band-aid things. We try to support things. We do not create anything. So the doctors out there that think they're like gods, especially surgeons, apparently they feel like gods. Let me wake you up. You're not a god. You're just a little plumber. You're a carpenter. I don't care how good a neurosurgeon, you're just a carpenter, or an orthopedic is a carpenter. You can give the neurosurgeons a little bit more credit, but unless you understand how to prevent disease, you are not really a good doctor. The good doctor diagnoses disease. A very good doctor treats disease. The best doctor prevents disease. That is hands down where we are in the 21st century. And people like myself will show the evidence of holding back the biological clock as part of the disease treatment and the prevention model. Not one of my patients have cancer. Not one of my patients has had a heart attack. Why? I've been doing this for a long time. One has to have it. Only the ones that don't listen to me end up having it, and I hear about them after the fact. All right, especially dementia. Do you want to wait until you have mild cognitive decline? I think even mild is too late, but do not wait for cognitive decline. That is one of the hardest things to reverse, but it all starts with changing your diet and lowering insulin resistance and getting rid of refined carbs. Where had I heard that story again? Didn't I hear that for the cholesterol story and fatty liver? Didn't I hear that story with heart disease? It's also for the brain. And you're going to find that those refined sugars also feed cancer. That's the connection. Thank you. Big love from Sudan. Wow. That's an all right. What is the way to increase your glutathione levels? I will tell you. What is the way? Oh, good. You got that. What is the way to increase your glutathione levels? Okay. I'll tell you what I do. Number one, try to minimize your body's need to neutralize toxins. So don't put the junk into your gut. The more junk you put into your gut, the more the body will use up the glutathione. So sometimes it's not about you not taking the glutathione and the foods and the supplements to build up. Sometimes you may have enough glutathione, but your body used it up. I'll give you an example. I had a 79-year-old lady who's now 83, and her glutathione levels, her vitamin C levels, her antioxidant levels were all very, very good. So when I saw a sudden change, at that time I saw an alteration in her white cell count. It was minor, but I thought that this does not look good. Sudden change in the antioxidant function, the immune function, the glutathione, the vitamin C, and then the white cell count is abnormal. The lymphocytes, I think, were abnormal. It had dropped. I sent it to a hematologist. They diagnosed stage 0 lymphoma. So they expected that patient would go back and they would diagnose stage 1, stage 2, but each time she went back, it remained stage 0 and then went away, so she was discharged. Why? Because we brought the glutathione levels up. We brought the vitamin C level up. Whatever was going on, challenge that individual because they were already very, very good. The body had its defenses, but it got depleted. And because we helped bring it back up, we altered the balance and they never progressed to any further lymphoma. Because as you get older, these things increase in risk and frequency. So number one, don't put the things into your body to challenge you, to consume not only glutathione, but all antioxidants. So if you have oxidation from eating bad foods, if you have oxidation from sedentary lifestyle, if you have oxidation from too much sunbathing, oxidation is also happens if you have toxic heavy metals in your body. Your body will use up not only glutathione, which is the master antioxidant, but all antioxidants like vitamin C, vitamin E, cysteine, selenium. There are a lot of antioxidants. They have wonderful things, but your body is going to use them as your line of defense. So number one, don't put the bad things in to use it up. Then number two, add the things in your diet. So cruciferous vegetables would be good for your liver. Berries that are colorful, that are vibrant, that are polyphenols, they're antioxidants. Not only are they antioxidants, they open up your arteries. There's documentation of increased blood flow with polyphenols. So eat colorful plants, eat colorful fruits and berries that are low glycemic, and you will nourish the microbes in your gut. That's probably the mechanism of action. You know, we think it's the vitamin we just took. So don't leave thinking that I only produce vitamin because I cannot produce the real food. You've got to eat it. That's the number one thing. The vitamins are to supplement your food. I'm not angry. I just talk loud. So your food has enzymes, provided they're grown well, provided you cook them well, provided you treat them well. Does the soil have minerals? Then the plant will have it. If the ground doesn't have minerals, your plants won't have minerals. Just like if you feed the cow corn, it's going to get fat. Corn is highly glycemic. Grass is not highly glycemic. Oh, that's so nice. Somebody gave me some water. Thank you. Stay hydrated. That's a good way to detox. It's also good to hydrate before you come in for an IV. So it's easier for me to find your vein. And if you want to know how much to drink, I don't believe in 8 glasses, 10 glasses, 12 glasses, a gallon. I have no idea. I don't actually like drinking. So what I would say is that if you're thirsty, drink water. And if you're not peeing, you better drink water. And if you are peeing and it's dark, you better drink more water. And if you look at your tongue and it's not shiny, you need to drink water. Am I clear? That's very simple. So a lot of people ask a lot of questions, but you just have to use common sense. You don't need a degree. You don't need to do some urine osmolality. You know, I can do that. So when someone comes in and I look at their vein and I can barely feel the volume, then I say, can I look at your tongue? It's dry. If I check the urine osmolality will be very high. I'm sorry, low. That means it's concentrated. Urine osmolality that's high means you've drunk a lot of water, it's dilute. And your pee will be light and colorful and fresh, not deep, dark, and ugly looking. Very melodramatic. What is the way to increase your glutathione? So the way to increase your glutathione, again, is to feed your body the prerequisites. So glycine and glutamic acid, or glutamine. Glutamine is also happens to be an amino acid that protects the lining of your intestines, which supports insulin sensitivity. And protecting the intestinal lining is key to keeping a very tight junction so you don't get leaky gut. So there are many, many benefits of glutamic acid or glutamine. So glutamic acid can be converted to glutamine, or you take glutamine itself, which is the preferable choice. So glutamine, glycine, cysteine, these are the things that will help you make glutathione. But the foods are cruciferous vegetables such as, wait for it, cauliflower, Brussels sprouts, cabbage, kale, watercress. Some foods which are bitter, like watercress and kale, these are actually good for you because they're better detoxifiers. Bitter taste activates your digestive system. So it's a combination of all the above. So, all right, Tanya, very kind words. And this live will be recorded so you can watch it. And because there are some terminologies that just seem a little bit complicated. So some of the other benefits of glutathione for people in the audience who know me or follow me, sometimes it's okay to come in for vanity reasons. You know, people want lighter skin, they want healthier skin. Glutathione is one of those things which is, if you're healthy on the inside, you're going to glow on the outside. You're going to be much more healthy. And so glutathione is not only the greatest scavenger of toxins, it actually will help you detoxify your mitochondria because all the work is done in your mitochondria. And the whole process of metabolism is to create energy through oxidation. So oxidation is a normal phenomenon, and your body has the ability to reduce it through adequate antioxidants, like glutathione, like vitamin C, like vitamin E. So that's why you need to have a very healthy diet, diverse. It's diverse so that your microbes will be diverse. And a diverse microbiome leads to less inflammation. So if you're having inflammation or you've been diagnosed with inflammatory diseases, autoimmune disease, change your diet, diversify your diet, get the vegetables with different types of fibers, let the microbes feed off the fibers, because even in the fiber, you have energy. Only the microbes can get that energy. You know, I always ask myself, how is it that a horse or a cow, particularly a horse, eats grass and they have muscles? Weren't we taught to believe that you got to eat protein to have muscles? In other words, there is fuel sources in anything and everything that you see around the world because somebody created it that way. But one source of fuel can be good for one person and it's bad for another person or another animal or organism. But the fact is that your microbes need fuel. They want the fiber as the fuel. For us, we want glucose as the fuel. We want protein as the fuel. We want fat as the fuel. So you want to feed yourself, but you need to feed the microbes. You need to feed the microbes because the microbes are the things that are going to help you digest. The microbes are the things that are going to protect the lining, that what we call the enterocytes. And if you keep the microbes happy, your gut will be happy. And if your gut's not happy, ask yourself what you put in that made the bugs unhappy. And that could be irritable bowel, bloating, gas, acid reflux, you name it. So you really need to think about it in a three-dimensional manner. We started with glutathione. We talked about liver. How do you increase it? We said what you put into your body is key. And if you don't concentrate on that, then you'll be working overtime trying to, it's like saying, you have a barrel of water and you have a hole in it, like your liver's not working great. Then no matter how much water you put into the barrel, it's going to get empty eventually. So it's important to plug up that barrel. And so that, in a different way, your liver needs to be in optimal form, not normal liver enzymes. Normal, what does normal mean? We want optimal. That means in the range, but we want in the healthy range. That's got to be half of the upper limit of normal, not in the normal range. It's got to be in the half of that range, which we call reference range, by the way. All right, let's see if we're good. There's a few more questions coming. So, it's all related. It's all related. Now, I have to be careful because I'm a doctor. I can't make claims. So, for the people who heard me say, and I did say it, I'm going to explain the full extent, that glutathione can be used to reduce toxic burden and as expressed by markers called gamma GT, GGT. Yep. Yeah, I'm going to do that. Just real quick to my disclaimer, not disclaimer, just a full explanation, is to say that glutathione is necessary for optimal function. In my clinical practice, I can bring down gamma GT using glutathione. I can say that because I do it. It's in my documentation, just to be clear. And for people with fatty liver, I use a strategy of altering their diet to get rid of the refined carbs, introduce things in their diet which are complex, then add supplementation to raise metabolism, as well as increase the glutathione, and then I get resolution to the fatty liver. So if you heard me correct. That's the way to do it. So don't think glutathione is the answer to everything. It's part of the strategy for three-dimensional medicine. Most doctors practice two-dimensional medicine. If something's high, they kind of lower it and hope for the best. Doesn't work. Okay, please talk about dry mouth. I had a client that had dry mouth, and no matter how much the water they drank, they were still dry. I actually can function without water, but somebody was kind enough to give it to me, so I'm going to drink it. So a wise man told me actually one time, have a cup on your desk. If it's empty, fill it with water. And if it's full, drink it. And really, simple is always the best. Because I'm not a good water drinker, because I don't feel thirst. But if I don't pee, I know that I got to drink more. In my 30s, I was feeling tired when I didn't drink enough water. Then when I drank, the tiredness went away. But it's because as I got older, my body wasn't functioning right. Now that I'm much older, because I'm so much more healthy than I used to be, because I sleep well, I eat only good food, I exercise properly, like I always did actually. And now, even if I'm dehydrated, I don't feel tired because my body is biologically younger again. So dry eyes and dry mouth, we call that sicca, S-I-C-C-A, sicca. Sicca can be an isolated problem, or it could be part of an autoimmune spectrum. I'll give you another example. I've got Raynaud's. I've always had Raynaud's. It's a genetic thing. So it could be an isolated Raynaud's, or what I think is the case, it could have been my genetic weakness, my genetic predisposition for autoimmune disease, which I don't have. Why? Because I made sure that I addressed all my weak genetics, which would have led to diabetes, blood pressure, heart attack, and stroke, which happens to also prevent autoimmune disease. Isn't that amazing? Isn't that amazing? It's like 4 specialties all in one. That's what integrative medicine is. And anybody that does two-dimensional medicine will never get good results. That's why when you treat blood pressure, cholesterol, diabetes, you only get a 25% reduction in secondary heart attack. I use my words carefully. For people who are medical, they know what secondary prevention is. And if you don't know, don't worry about it. It's not important. Anyway, dry eyes, dry mouth. Let's continue. It could be part of an autoimmune spectrum. It could be the beginning. I had a 18-year-old boy that had dry eyes, dry mouth, and the doctors wouldn't diagnose the disease because, one of the markers were elevated. One of the markers. So it's not enough to diagnose. So there's nothing to do. Bad idea. And so when I engaged in my protocols of eliminating foods which were immunologically inflammatory, I eliminated them from his diet. When I measured the nutrients in his body, I replaced them. And he started to get better. I also introduced intravenous vitamins to boost his immune system. So, but he's not out of the woods. Once I make him better, he's got to maintain the diet because the poor boy's got a bad diet. I don't blame the kid. I blame the parents. And if you're watching, you know who you are. And if I do a bad job for my kids, I blame myself. You don't blame your kids. Yeah, kids can be a little challenging. They're kids. They have their desires. But we're the adults. We're the parents. We've got to find out a way to train them, help them, not only with the studies, you got to help them with every aspect of life. And so dry eyes, dry mouth, hopefully that helps. There's always going to be a doctor that's going to give you a treatment. I don't know what. Dry eyes, they have drops, but for the dry mouth, I don't know. What is the drug? They have a drug for dry eyes, and I can't think of the name right now. But again, controlling the symptom is not going to solve the problem. I think it's you better that you understand that the dry mouth is part of an autoimmune spectrum. Mild, no doubt, it needs to be addressed. I had them drink aloe vera and ginger to produce saliva. That's a great idea. If it works, wonderful. And then, so we're going to wrap up a few more final questions if we can. And what time are we at now? 1:30. Yeah, that's right. Okay. So I'm a real doctor, so I have to see real patients. Okay. Best glutamine brand to take. Look, I'm not really going to be able to say all of those. There are many good companies, so I would just say the companies. So I can't tell you the brand. There's good companies out there. Thorne is a good company. Carlson is a good company. I'm giving away. They should pay me for advertising them, right? Designs for Health, Orthomolecular, Numedica, Metagenics. So those are. But if you want to message me directly, then I can give you more specifics on which brand and why. Each brand is somewhat different, so it depends on what you're looking for. So you can customize it because many of them have combinations of things. So they're all good, but some of them may have a combination that's more at the mucus level, lining. Some of it could be at so it depends on what they combine it with. You very rarely find a good company that just does one product by itself. Usually will have something synergistic about it. That's one way to differentiate a good from a bad company. That whatever that main ingredient is, they will put additional ingredients to make it synergistic, to make it more absorbable, more effective, more potent. All right. I didn't quite understand conjoint nerve pain, but we can definitely leave neuropathy as a good subject area to talk about next time, which will be soon. I mean, today's already Thursday. Friday may be challenging, but next week, next Tuesday or next Wednesday, and certainly next Thursday would be a great opportunity to do that. So hey there, this is Tanya, who's a phlebotomist. Please drink your water. Okay, thank you for that. Appreciate that. All right. Okay. I'm. Okay, yeah, we're going to save all this. So thank you very much for joining, and thank you for your good questions. And we'll do the open questions and answers. Frankly, anytime I talk about anything, I know I do go on a little bit, but after about 10 to 15 minutes of me talking, I would definitely like to answer questions that people may have. And, common is common, so it's okay to talk about blood pressure over and over or heart disease over and over. Remember, the three most common diseases, the things that will kill you, number one is heart disease, number two is cancer, number three is it will lead to those problems is fatty liver, and then dementia and insulin resistance kind of go hand in hand. And so I really appreciate you guys joining me. Hopefully there was something useful there, and just remember that you need to think of your whole body. That's why we call it holistic medicine, and understand that they all work at the same time. Not when your doctor decides to sit in front of you. Your body is integrated. It's constantly receiving signals and responding in real time between not only the different organs but the brain and the organ. And one of these days we need to talk about the brain and how it affects the immune system through the gut, right? Everything goes through the gut, but really it's a two-way communication between the gut and the brain. And so look, in closing, what I want to tell people is that don't just rely on waiting for the diagnosis. try to take control in your own way. If you have symptoms and the doctor can't find the diagnosis, it's called dysfunction. Because he's using the parameters, the testing for disease, he's missing it and telling you falsely that you don't have anything. You know, disease doesn't come overnight. You lose the function until you have dysfunction. And then from dysfunction, if you don't address it, you get the disease. That's when he's picking it out, or she. So don't buy that. That's old-fashioned medicine. We're way beyond that. And so if you reach out to me for consultations, either remotely or face-to-face, not only can we predict and prevent it, we can find out strategies to reverse it. At the very least, control it with the least amount of medication so that your body can make its own nitric oxide. Your body can make its own hormone. Your body can make its own growth hormone. Your body can regenerate itself. You've got to stimulate the regenerative things. And so when I do my 5 pillars, number 1 is that I tell people, sleep, sleep, sleep. Do not damage it. Number 2, don't put the bad stuff in. Number 3, put the good stuff in and then supplement that, the vitamin, and then do what I do to engage all those longevity genes, to engage those growth factors, to engage the pathways for preventing disease. And we do that through a variety of therapies that are both intravenous, that means in the veins. We do that by stressing the body. We can utilize hyperbaric oxygen chambers and many, many more. And that could be even for cosmetic stuff. But first we get the body healthy on the inside, then we stimulate, health on the outside. I'll leave it at that. And so thank you very much for joining. Hope to that we join again. All right, take care. Have a great day.